Well, good afternoon. I've said from the start that we will stop at nothing to protect Ontario in this fight against COVID-19. We will stop at nothing to give every Ontarian the support they need and the tools they need to overcome this terrible, terrible virus. We'll use every tool in our toolbox in this fight, and earlier this week, we put those tools to work as part of our $17 billion package to provide support and relief to Ontario. And heading into the weekend, you'll see another tool in our toolbox put to good use. This afternoon, we'll be issuing a province-wide emergency alert. It will read as follows. Travelers returning to Ontario, you're at high risk of spreading COVID-19. You're required by law to self-isolate for 14 days. Do not visit stores, family, or friends. Everyone should stay home to stop the spread. This will be the first, but most likely not the last time we use this powerful tool. Because as government, one of the most important things we can do right now is keep the public informed and make sure you know how to keep yourselves and your loved ones and your community safe. We will continue to use every means necessary to share this vital information with the public. But I'm also here today to share important information that is vital to businesses. We're going to do what it takes to provide businesses with certainty during these difficult times. That's why we've allocated $10 billion to help businesses improve their cash flow through Ontario's action plan. That includes $6 billion in tax deferrals for businesses and another $1.9 billion in WSIB payment deferrals for up to 6 months. I'd also like to thank the Prime Minister and his team for their announcement today. I want to thank them for listening to our calls for additional supports for workers and businesses. The wage subsidy will help hundreds of thousands of businesses and workers get through this crisis. Because if we support our businesses and if we protect our jobs, when this storm passes, we'll get back on our feet. And we will come back stronger and more united than ever before. Thank you, and God bless the people of Ontario. I'll pass it over to my Finance Minister, Rod Phillips.
Thank you, Premier. Over the past couple of days, I provided details about our government's first steps in the response to COVID-19 to ensure the health care system, our communities, and our economy are well positioned to weather the challenges ahead. Today, I want to speak to you about our plans to support Ontario's businesses. As you're all aware, COVID-19 has deeply impacted individuals, families, and businesses around the world. We're facing an unprecedented time in our history. I've spoken with business leaders across the province, and I'm heartened to hear all that they are doing to support their workers. And rest assured, we'll continue to support Ontario's employers. For example, we know that the hospitality sector is struggling through the COVID-19 outbreak. Yesterday, an important change was announced to provide restaurants and bars some support. Ontario will allow takeout and delivery of alcohol with a food order from licensed restaurants and bars. Delivery can be carried out by the restaurant or the bar or by a third-party service. Of course, safety remains a top concern, and the same conditions will apply to in-house as they do to in-house sales, such as checking ID to protect from minors, and they'll apply for alcohol when it's delivered to someone's home. That's one example of how we can provide some relief for our businesses. Now, we know that the most pressing need for employers right now, as the Premier said, is cash flow. Business owners need to meet their immediate costs so they can keep the lights on and keep employees on the payroll. And that's why, as part of our first steps to support employers, I announced that we're making $10 billion available to support cash flow for people and businesses through tax and other deferrals that'll be coming in the next months. This will provide relief during this challenging economic time and build on the federal government's actions. I've worked closely with my federal counterpart, Minister Monod, as our government responds to COVID-19. In fact, I spoke to the Minister earlier today, and I do want to commend him, as the Premier did, and the Government of Canada for their significant move to support small and medium businesses in Ontario and across Canada. Premier Ford and many of the other premiers have been advocating for these types of additional supports, and I've spoken to Minister Morneau about them as well. They're going to make a real difference for our small and medium-sized businesses at this critical juncture, so thank you. I'm grateful the federal government has been so receptive to the government's feedback. We're providing a 5-month interest-free penalty or grace penalty for businesses to file or pay most provincially administered taxes. Starting next week, on April 1st, this measure will provide flexibility to about 100,000 businesses in Ontario. For this period, businesses will not be charged a penalty or interest on any late returns or incomplete or late tax payments under selected provincially administered taxes, such as employer health taxes, tobacco taxes, and gas taxes. This action will keep $6 billion in the economy. In response to the feedback we heard from municipal leaders, we're also deferring the property tax payments municipalities make to school boards by 90 days. This will provide municipalities with the flexibilities, in turn, to offer over $1.8 billion in urgent relief for people and businesses. To ensure this does not have a financial impact on school boards, the province will adjust payments to school boards to offset the deferral. With the Workplace Safety and Insurance Board allowing premiums to be deferred by up to 6 months, employers will be provided with another $1.9 billion in financial relief. All employers covered by the WSIB's workplace insurance are automatically eligible for this financial relief package. And in addition, no interest will be accrued on outstanding premium payments and no penalties will be charged during the 6-month deferral period. In total, these supports make $10 billion available to support cash flow for people and businesses. Our government is also cutting taxes by $355 million for about 57,000 employers through a temporary increase in the employer health tax exemption to $1 million for 2020. With this plan, more than 90% of private sector employers would not pay employer health tax in 2020. Small business owners are also concerned about the price of electricity, and our work to stabilize electricity prices continues. We will increase the funding for our energy subsidies by $1.5 billion to $5.6 billion this year, providing direct relief for every small business and farm in Ontario, as well as families across the province. And in response to COVID-19, we're going a step further. We heard loud and clear concerns from people and small businesses about time-of-use metering. That's why the Premier and Minister Rickford announced that we are setting time-of-use electricity pricing for residential, farm, and small business customers at the lowest rate, known as off-peak price, for 24 hours a day starting on March the 24th. This will leave more money with employers when they need it the most. In fact, a small business consuming 10 megawatts an hour a month would save $308 on their monthly bill. Although we don't know the full impacts of COVID-19, we know that it's going to impact the health and of our economy. We do know that together, these actions can free up billions in cash flow for businesses and people in these uncertain times, helping protect jobs and helping protect household budgets. I was confident in Ontario before COVID-19, and I remain confident today. By acting decisively and working together with our partners, Ontario will weather the challenges ahead. And now I'd like to introduce our colleague, Associate Minister of Small Business and Red Tape Reduction, Prab Sarkaria. Prab?
Thank you, Minister Phillips, and good afternoon, everyone. It's never been more important to keep the lines of communication with our small business community open. This is why virtual meetings and roundtables with various small business sectors have become a regular part of our day. And it's also why I'm grateful for the chance to speak directly to Ontario's small business community today. As you all know, on Monday, Premier Ford announced the mandatory closure of all non-essential workplaces. And we hear you when you tell us how difficult this is for so many of you. We hear you when you tell us that your small business supports your family of 5, or that 6 employees depend on you for paychecks each week. We hear you when you tell us that you are worried about your business's ability to brave this storm. We know it's not easy, and that many of you have put everything you have into building up your business. But we also hear you when you tell us that you support the steps we are taking. and that you want to do whatever you can to help stop the spread of COVID-19. Safeguarding public health is not only a healthcare priority, it's an economic priority as well. The best thing we can do for small businesses, for Ontario's competitiveness, and for the hardworking families eager to get back on the job is solve this healthcare challenge first and as quickly as possible. The sooner we're able to stop the spread of COVID-19, the sooner businesses can reopen, everyday social activities can resume, and Ontario's talented, skilled, and resilient workforce can get back to doing what they do best, innovating, manufacturing, and delivering made-in-Ontario goods to markets across Canada and beyond. Small businesses tell us they need help braving this storm, and Ontario is your partner. We depend on small businesses to drive our economy forward. This is why I am pleased that, as our first step, we have helped businesses focus on their families and immediate needs, while we work with our federal and municipal partners to take strong actions to support you. Working together, we are encouraged that the Prime Minister announced today that the federal government will be increasing the small business wage subsidy. This will put us in line with many of our European counterparts, and along with small business loans and other measures announced by our federal partners, will provide significant support. We look forward to seeing the full details of these measures in the coming days. Together with the Ontario Action Plan released this week, our small business community should be encouraged by the scale and scope of supports our joint efforts will provide. These are just first steps we are taking to help Ontario move forward. Ontario's small businesses are the lifeblood of our economy, and through the Ontario Together project, we've seen some businesses step out, help out in remarkable ways. Overcoming this challenge is going to take all hands on deck and bold plans like the Ontario Action Plan. But I am confident we will overcome it for 3 reasons. 1, we are Canadians. There's nothing we can't do once we're united in purpose. 2, there's help. All levels of government are working in close partnership to make sure Ontario families and businesses get the supports they need. And 3, this is Ontario, home to some of the most resilient people, vibrant communities, and innovative businesses anywhere. The work ahead is significant. The challenges are real, but Ontario together will overcome them. Thank you.
Okay, we'll take questions from the phone line. First question.
First question comes from Travis Dunrush of Global News. Please go ahead.
Good afternoon. This question is for Minister Elliott. Minister, you keep saying that hospitals have what they need, but we know that is simply not the case. Ontario has about 12 respirators per 100,000 people. There are serious concerns from frontline workers that supplies are low, and literal over a month that hospitals could potentially run out of respirators. Workers are worried about a situation like we're seeing in New York. So if everything is fine, why are there these reports from doctors, nurses, and other health experts?
Well, I can tell you that we are actively working on procurement of personal protective equipment and ventilators each and every day. I know the Premier spends a good part of his day on the phone asking for companies to come forward, as I do as well. This is one of the most important things that we can do. We know that our frontline workers need to be protected to continue to do the absolutely great work that they're doing each and every day. But we want to protect them, we want to protect their families, and we want to protect their patients as well. So we are actively obtaining this equipment through our regular suppliers, through our work with the federal government. The federal government is able to achieve large orders. We're waiting to receive shipments from them, but we're also reaching out to Ontario companies who are actively involved in changing their production lines, doing whatever they can to produce this supply. We have an active order that we're working on with auto parts suppliers to supply us with an additional 10,000 ventilators. This is going to be vital. We need to have this in our hospitals, and we are procuring all of the necessary supplies each and every day.
Okay, my next question is for the Premier. Premier, how did you decide what's an essential service, and why are things like health supplement stores, pet spas, and fitness equipment stores considered essential?
Well, Travis, when we sat down with groups, no matter if it's association or labor leaders or the Ontario Public Service, ran through that list, and I've always said we're reviewing it daily, and we have that 1-800 number. We also have a website. If people feel that their business should be on there, we can review it. If they feel companies shouldn't be on there, we can take them off, but we're adjusting that list and looking at it absolutely every single day. So again, we'll be open to any ideas out there, and we'll adjust that list.
Next question.
Next question comes from Christina Tenaglia of CP24. Please go ahead.
Thank you so much. My question is for Premier Ford, again, following up on the essential services list. We've received some questions about some gray areas in the list. So to give you a specific example, we've heard from someone who owns a small independent auto detail cleaning shop in Ontario. They service private and corporate clients, and when you brought out forward your essential services list, they weren't sure if they were allowed to open, and they feel they've been left in a gray zone. They say their corporate and private clients are afraid of COVID-19 in their vehicles and want it gone, but since they aren't classed as a dealership or have any dealership ties, they were left hanging. This specific person tells us that when they contacted Minister McNaughton's office and Premier, your toll-free number, they received a lot of help. They're very grateful for that. But the final answer was, we can't advise you one way or another. You fall into a gray zone, so you have to use your own discretion as to whether or not you open. People like this don't want to be fined. So what's your advice for those in a gray zone?
Yeah, I appreciate that, Christina, and what we're doing, again, we're reviewing the list, but let me tell you, if they're an essential service, making sure that cars that, let's say, pick people up from the airport and they rely on a cleaning service to sanitize their car, I actually encourage that. No one wants to get in a car that they don't feel has been sanitized. So I think they would fall under essential service. If it has to do with making sure we pick people up and transfer them from point A to point B, everyone wants to make sure their car is disinfected. So I think that would be fall under an essential service. Again, there's so many different businesses. There's thousands and thousands of businesses out there, and we're doing our best to make sure that we answer all the calls. I think the first day, Christina, we had 53,000 calls, and we have a whole team on it trying to return every single call, answer the emails. But there are going to be some areas that are a little gray for people, and I appreciate that. So I think on that area, I think that would be essential to make sure cars and vehicles that are picking up other passengers, they need to be cleaned and disinfected.
Thanks, Premier. And very quickly, when can parents expect to get more guidance on the school year?
Had a good conversation last night with Minister Lecce. I know in the next day or so, he's going to be speaking to the media. He's making sure that they have a proper plan moving forward. But the number one concern is the safety of our children. That's first and foremost. But we also want to make sure that they can learn on the younger kids. And I want to thank the people at TVO. They're doing a great job. So even if you don't have cable, you can go to Channel 2 and they can do a lot of learning off TVO. But there is a plan. He's going to be rolling that out in the next day or so.
Next question.
Thank you, Premier.
Thank you.
Next question
comes from Colin DeMello from CTV News. Please go ahead.
Hi, good afternoon. My question is for Health Minister Christine Elliott.
Yeah.
So as the number of cases in Ontario steadily rise and more people require hospitalization, how should doctors prioritize care in your view? Should ventilators be administered on a first-come, first-served basis, on the severity of the case, or on demographics?
We are building up our supply of ventilators so that doctors will be able to supply them to whomever needs them. We have seen what's happened in other parts of the world. We don't want Ontario to be in that situation. That's why we're working very hard to build up capacity in our hospitals, personal protective equipment, as well as ventilators. Anyone who needs one should have access to a ventilator.
There are calls from some frontline physicians, though, to create an ethical framework for doctors, giving them the ease of mind when they have to make difficult decisions. So 2 patients, similar conditions, arrive at the hospital at the same time. There's 1 ventilator remaining. Who does that ventilator go to? Is the government working on creating any kind of ethical guidelines before we reach that surge?
Well, first of all, as I indicated before, we intend to have ventilators available to whomever needs them. But yes, we have an ethicist that is at the command table. We are building out an ethical framework. Any physicians who have any questions right now or in the future can certainly refer to the ethicist for guidance. We recognize that there will be situations where there may be assistance that's needed in that. But certainly with respect to the issue of ventilators, we are preparing to obtain a supply that will serve all Ontarians.
Next question.
Next question comes from Lucas Meyer of News Talk 1010. Please go ahead.
Thank you for taking our questions. First, again for Health Minister Elliott. Minister, with the increase in deaths, can you confirm if any of these deaths are younger, possibly in their 30s? Are we starting to see anything like that?
Unfortunately, most of the deaths that we've seen so far have been with more elderly people, many of whom have had other health issues as well. That's why it's really important for us to really protect those vulnerable populations in long-term care homes, in retirement homes, people who have intellectual disabilities that perhaps live in a group home. They need to be protected. We really need to put a focus on that. And I'm working with my colleague, Dr. Marilee Fullerton, our Minister of Long-Term Care. We know that these populations particularly need to be affected. But as things change, we may well see younger people becoming affected as well. But to date, it has been mostly seniors with other health situations.
So just to be clear, so you're not aware of anybody passing in their 30s?
I believe there is one person who is in their 40s that may have passed away, that has passed away, I should say, I'm sorry. But the vast majority thus far have been seniors.
Next question.
Next question comes from Cynthia Mulligan of City News. Please go ahead.
Hello, this is for Health Minister Christine Elliott. Hi, Minister. I am getting deluged with questions from cancer patients after my story yesterday. They're terrified because so many have had their cancer surgeries postponed. Can you give them more answers, please? How many surgeries are being postponed? What are the guidelines? One oncologist is saying all are now considered elective unless the patient is in distress within the next 3 or 4 months. How long will these postponements last?
Well, thank you for the question, Cynthia. This is a very serious issue, I know, to many people, people who have cancer who have been told that their surgeries are going to be postponed. But unfortunately, this is something that we need to do unless that person's life is in danger. And these are decisions that are being made with respect to each individual patient, by the hospitals, by their physicians, and with the assistance of the Cancer Care Ontario Division of Ontario Health. So this isn't just everybody who has a surgery that's coming up is going to be canceled. Not at all. We are taking into consideration the personal health situation of each and every person. And if it is life-threatening, they will, of course, get the surgery that they need. But I do want to stress that this is something that we take into consideration with each and every patient, with the assistance of Cancer Care Ontario, who developed a pandemic plan years ago, and they're putting this plan into action now. I wish we didn't need to do so, but as we all know, these are extraordinary times, and we have to make very, very difficult decisions.
Premier Ford, my next question is for you. What do you have to say to these cancer patients? They are terrified. What is your message to them?
You know something, it's heartbreaking even hearing the stories. I don't have to tell people I lost 3 close loved family members, my mother, my brother, and my father, on cancer. And you know something, I understand the pain and the agony they're going through in their hearts and their family members concerned. As the Minister Elliott mentioned, that we really have to rely on the advice of the medical professionals, Cancer Care Ontario, and our health team. But my heart breaks for them, and the pain, the uncertainty. But again, we have to rely on our health professionals to make that call. There's nothing more than I want to see is these patients taken care of and helped out, and we'll do everything we can to get these folks taken care of, and we'll ask the question again to Cancer Care Ontario and our team, our healthcare team. It's heartbreaking to hear these stories. Believe me, I wish I could jump in there and you know, help everyone, and that's our goal, is to do that. It's hard. It's challenging for these families right now.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
A question for both Premier Ford and Finance Minister Phillips. The federal government made their decision on the 75% wage subsidy on the backdrop of some pretty stark financial numbers. We saw the Bank of Canada reduce its overnight rate again. The Parliamentary Budget Officer is predicting a 2.5% decline in first quarter GDP, but a 25% decline in the second quarter, the biggest or weakest economic record since 1962. They're predicting that we'll see 15% unemployment and social isolation remaining in place until August. Does any of this match what you are seeing, what you are being advised in terms of what Ontario needs to prepare for over the coming months?
Well, good question, Brian, and we're running through this on a daily basis, myself and the Finance Minister and the President of Treasury, Peter Bethenfalvey. We're looking at the numbers. We're looking at other provinces, the situation they're in, along with the federal government. Yeah, there's going to be challenging times. There's no doubt, and that's all the more reason we have to make sure that we do everything we can to stop this virus, make sure that people follow the rules, and give people certainty. We're gearing up. There's new technology coming our way in the testing kits, so we can speed up the testing, get more results. And if you look at any country in the world, you know, the people that are getting ahead of this curve, flattening the curve and slowing the spread, are the countries that are doing mass testing, and that's our goal. And I can see a glimmer of light at the end of the tunnel when I talk to these pharma companies, and more supplies, more technology are coming our way, and we're able to place some very large orders yesterday for this technology. And I just want to surge the whole system, get out there and make sure that we give people certainty. People want certainty. And that goes back to Cynthia's question earlier on. People want certainty in life. We're doing everything we can to make sure we stop this spread, and using every technology, every tool we have to make sure we do exactly that. And the businesses are all stepping up, helping out in the technology ingenuity of the auto part manufacturers, as we've said in our past announcements. But I'm going to let the Minister of Finance talk about the finances of our province compared to the federal government.
Thanks, Premier, and thank you, Brian. Clearly, I think the Premier is obviously right about the focus on health. Underlying this economic uncertainty is the health issue that we are putting every resource we have at our disposal against, and both the Minister and Premier have talked about that clearly. I think your question is a good one. When I spoke to Bill Morneau this morning about the additional measures they were taking, and clearly we are seeing forecasts from a variety of places, and the only thing we know about any one forecast is it won't be right, but those forecasts are suggesting, as our forecast did as well, sort of reduced economic growth. And I think the focus we have to put on it, the forecasts are interesting, but is what are we doing to step up to try to support business, to try to support the people that are affected by it, so that once the underlying health issue has been resolved by the kind of actions that the Premier and the Minister of Health have talked about, that the economy will be there to bounce back. So that's why the deferrals we talked about today, the $10 billion worth of deferrals, the tax reduction that we talked about, the HT, the actions that the federal government has taken in terms of the additional wage subsidy, the HST deferral as well, which will include the Ontario portion of the HST deferral till June. Those are all very positive supports, and we're also seeing, of course, as I've said before, unprecedented monetary and fiscal interventions around the world, not just in Canada, but working its way through the House of Representatives, a $2 trillion package in the United States, so vital, the United States economy to the Canadian economy in terms of our ability to respond. So we're watching all these indicators. Nobody has a crystal ball, but I'm confident that the unprecedented action taken by all governments, ours, the federal government, international, all the other national governments, are going to make as big a dent as they can in this, and then we'll continue to provide the resources, getting back to the first point, to the healthcare system, because underlying it all is making sure that we're all doing individually the right things, that we're physically isolating, that we're taking care of each other, but that we are helping the healthcare system handle this healthcare issue, this healthcare crisis, so that we can deal with the economic situation.
For a follow-up, Premier, I'd like to ask you about news that we're getting now of an announcement by the Toronto Police Association. They're going to be offering all of their members, who of course are on the front lines of fighting this, and we've heard some of the stories of what police are dealing with. The union will essentially be reimbursing them $1,000 each. They're going to give $100,000 for support groups dealing with mental health and PTSD, for people and families dealing with this issue, and $250,000 to the University Health Network. Wow. They're challenging other labor groups to take similar steps. Have you talked to Mike McCormick about this? Have you talked to other labor leaders about similar measures that they can take? As you and others keep saying everyone's in this together, what have you been discussing with labor leaders?
Well, first of all, I want to congratulate Mike McCormick and his entire board for doing that. That's absolutely amazing, giving each frontline officer and staff $1,000. That goes a long way, and I want to thank them. I know all the large associations and unions, they have a reserve, and most of them have pretty large reserves. So I take them up on that challenge. I'll add on to that challenge. We do challenge all the other associations and unions to follow in the Toronto Police Services footsteps and supporting the front line. The reason they have reserves are exactly for these times, some of the toughest times people are facing and they've ever faced in their life. So I encourage all the unions and labor associations follow in Toronto Police's footsteps. There's never a time that people needs a little bit of cash in their pocket than right now. So again, congratulations to the Toronto Police Services board and Mike McCormick. They're champions, so way to go. That's great news. I appreciate that. Thank you.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hello, Premier. Just intrigued by your new order about travelers returning. I'm assuming it's travelers from abroad, or are you including anyone who's traveled in Canada in that? When will this take effect, and how much will the penalties be, and what triggered it? I know a lot of people are self-isolating when they get home, but what are you hearing about people who aren't?
People have been so good. We just want to make sure we enforce it. When people are away, Rob, they may not be able to hear the news, what's happening here in Toronto, and when they come back home, it's not business as usual. We just want to reinforce the message from the federal government as well, and our chief medical officer, to please stay at home, don't go to the store, don't visit family members, because you're putting your family at risk, and no one wants to do that. That's what the message is going to be. I just want to be very transparent and give people a heads up. That's what we'll be using, just really reinforcing the message. But I just want to say vast majority of people are cooperating, and I'm so grateful for everyone listening to the Chief Medical Officer. So thank you, everyone. And can I mention one more thing, Rob, because I promised the rural mayors and the wardens in municipalities, especially in cottage country. I've been getting a tremendous amount of calls from cottage country mayors, if I can call them that, and residents too. If you have a cottage, they're just asking you, please don't come up the cottage, because what's happening, and then I'm just getting this secondhand from all regions, actually, not just one area, that if a whole bunch of people head up there, the retail stores don't have the vital essentials to keep the people that live up there all year round, and also the hospitals, they don't have the capacity we do in urban settings. And as they all say, we're going to welcome you with open arms when we get through this. But right now, it's putting a lot of strain on their system up there. So I just want to pass that message on. There's, I have a cottage. I'd love to go up there, but you just can't right now. So I appreciate that. On the second note about, I just want to mention about this price gouging that's happening. We had an in-depth conversation at Cabinet. Our Cabinet supports me 1,000% in moving forward. We're making sure that we're going through the Solicitor General along with the Attorney General to come up with very, very strict fines and very large fines, because I just won't tolerate it. Anyone who wants to gouge the public in these times, we're going to come down hard. We're going to come down really hard on them. So I just getting that out there. So in the next day or so, we'll be announcing exactly what we're going to do, because there's just too many great people, too many great companies out there that are stepping up, volunteering, donating their time and their technology ingenuity to the cause. So the last thing we want are price gougers out there. But thanks for letting me say that.
Okay, thank you for that. It saved me a couple of questions. I just have one quick follow-up.
Yes.
We've now had a poor chap who worked out at a superstore in Oshawa pass away from coronavirus, and now Longos has had a grocery gateway driver who's tested positive, and a supermarket employee at Longos has tested positive. Should people be worried about getting their groceries delivered or going to the supermarket?
Well, we have two scenarios. We all know it's an essential service, and we talk about unsung heroes. I want to thank, first of all the healthcare workers, the first responders. But do you know what we need to thank every time we go through that grocery line? The person at the cash register, the person that's stocking the shelves, they're the unsung heroes. They're the ones that are coming in day after day to make sure that we have food on our tables. And I just want to thank them. I want to thank them for their service. And I know the retailers are doing everything they can. I know they're putting the shields up at the cash register. They're giving their employees protective gloves, and that's what they need to do, especially companies like Grocery Gateway, which is an incredible company, by the way. They're really stepping up and filling in a great service that we need to deliver directly to the homes. They have to make sure that their employees are well protected. They're a very reputable company, and I know they're going to do everything they can to protect their employees.
Next question.
Next question comes from Alison Martel of Reuters. Please go ahead.
Thank you. Premier, we've heard from some ventilator manufacturers that they're fielding many separate calls from governments and hospitals across Canada, and that they'd prefer that the federal government centralize this process, placing orders and deciding how new ventilators will be distributed across the country. Would you be willing to accept something like that and give up your own ventilator procurement effort?
Well, we have an incredible, I personally have an incredible relationship with Chrystia Freeland, the Deputy Prime Minister. she's working hand in hand with me. I was on the phone again late last night with her, telling her exactly what we're doing in support with the federal government. We're in full communications. Before we cut a PO yesterday, I consulted with the federal government. They gave me the nod to say, hey, we're behind you in this and keep going. One comment the Deputy Prime Minister said, Doug, when that assembly line starts, do not stop it. If we have 10,000 ventilators on order, and we're going to make sure we don't just take care of the people of Ontario, we're going to take care of the rest of the province. I had a conference call with all the premiers yesterday. They're really, really relying on the province of Ontario. We're the manufacturing engine of Canada. We're using our manufacturing might, ingenuity, and engineering skills. And I just can't say enough about the 4 companies that are making this happen: Martin Rea, Woodbridge, Linamar, and Magna. You talk about champions, and what they're telling me is, we're gonna make sure we have the best of the best working together. So again, I want to thank the federal government for collaboration with us.
Okay, that's all the time we have. Thank you.
Well, thank you, everyone, and God bless you. Thank you.